Advanced VisionCare was established in 2003, primarily for patients who were looking for laser treatment, either LASIK or LASEK.
And obviously I did do quite a bit of research looking them up on the internet, including the doctors involved. I wasn't out for going to cheap places because, let's face it, your eyes are the most precious thing that you have.
But I had looked at other companies, not this year, but before, and I didn't enjoy the pressure sell that they were doing. It didn't inspire me with confidence.
The people who worked here seem to know their stuff and what they're talking about, whereas the impression that I got from others were that they would recommend you for any surgery.
We wanted to start a laser clinic, which is high quality and also same time affordable. Okay? We want to treat patients as individuals, not as numbers. Okay? And we want to run it as purely a medical practice, okay, where we can give unbiased, not sales-oriented, good medical advice.
The most important things to consider when you're going for laser eye surgery is to know your surgeon, make sure you're going to get a transparent, inclusive cost, that there's a comprehensive aftercare package, and the service you receive from the very first moment you walk through the door to the 12 months post-operative care are to a very high standard.
When the patient arrives at the clinic, the optometrist will take the patient for a series of diagnostics examinations. This is to ensure that we have all the data for the surgeon to make a choice if patient is suitable for the treatment.
And hold.
The first machine we do use is the OrbScan topographer. The OrbScan topographer is an advanced corneal mapping system which scans your eyes to produce detailed maps of your corneas, showing us every minute detail of the corneas which are imperative to assess suitability. The information gathered from the OrbScan topographer is then transferred to the Xywave aberrometer, which scans your eyes and measures any imperfections in your eyes. It is these imperfections that are then corrected with your prescription when you undergo laser treatment.
Very nice picture from here.
The consultant surgeon will go through all the measurements that have been taken, and from the measurements he can actually make an informed decision of the treatment plan that's suitable for that particular patient.
Sexy for me.
Then the patient will be passed on to our counsellor, who then will go through all aspects of the actual patient journey on the day of surgery.
We treat patients with short-sightedness or patient with long-sighted, that is minus prescription or a plus prescription, and also complicated astigmatism. Okay? So all these problems can be fixed with the laser surgery.
But one of the good things that I would say through the process, through the procedure, was that they tell you all the time, second by second, what's happening to you. And so nothing is a surprise.
The important thing is don't fight this, just go with the flow.
I have performed over 20,000 laser procedures, and also not only laser procedures, I have performed other eye surgeries, cataracts and glaucoma, and which gives you a whole approach for the eye problems that patients have.
KVOF.
That's a driving standard.
Really?
It's only 10 minutes.
Yeah?
All this will become clear.
That's quite amazing.
Advanced VisionCare has very strong ethical principles. If a patient's not suitable for laser, it's near the borders or the boundaries, it's not something that we would take on. However, there are a number of other procedures which we could do.
Now, for people who are not suitable for laser surgery for higher prescriptions, or the cornea is not very thick, we can offer implantable contact lenses, where the contact lens is insert inside the eye, which will correct the prescription, which is safe and effective. Or people over the age of 45, we can exchange a normal human lens with artificial lens, by which we can correct distance and reading glasses. The success of the laser surgery is not only performing the surgery, but looking after the patient in the post-operative period up to a year by the same surgeon, the same clinical team.
Built into the cost is obviously the treatment by one of the most experienced refractive surgeons in the UK. There's all of your aftercare that's built into that. If you live outside the M25, we'll put the patient up for one night in a 4-star hotel.
It was an all-inclusive package, so I liked the idea of that. That meant that I knew how much I was going to pay, and it was going to be no more and also no less, but I knew how much it was going to be.
You also have unlimited access to the surgeon should you need it in the first 12 months for any additional aftercares.
The service I received from Advanced VisionCare was absolutely outstanding, and I couldn't recommend them highly enough to anyone.
A highly experienced surgeon, a very comprehensive pre-surgical screening process, high quality surgery with the latest technology, an all-inclusive aftercare package and a transparent cost. If those are the things that are important to you, you should certainly consider Advanced VisionCare for your laser treatment.